Hi, I'm Emily. I'm going to be your NP. I'm going to start by looking at your head, your hair, your face, your scalp. Everything looks symmetrical, no bumps or scars. I'm going to palpate your pulses. Good. I'm going to test your cranial nerves. So can you frown? Can you raise your eyebrows? Can you close your eyes tight? You can open them. Can you smile with your teeth? And can you puff out your cheeks? Good. Next, I'm going to palpate your temporal and your vestibular muscles by palpating your temporal mandibular joint. So can you open and close your mouth a few times? Good. And clench your jaw. Good. Now I'm going to use this cotton ball and touch your face. So just let me know when you feel me touching with your eyes closed.
No.
Good. You can open. Did it feel the same on both sides?
Yeah.
Good. Okay. Now I'm going to be looking at your eyes. Your eyelashes and your eyebrows are symmetrical. They look good. I'm going to take a look at your conjunctiva. So look up for me. Look down. Look left. And look right. Good. Now I'm going to test accommodation, convergence, and EOMs. Sorry. So just follow my finger and with your eyes and don't move your head. Good. Now I'm going to test your pupillary response. So I'm going to dim the lights. You're just going to look straight at me, and I'm going to flash a light in your eyes.
These things are tricky.
Why don't the light turn on? Oh, there we go. Okay. So look straight look straight at me. And I'm gonna flash the light a couple times. So I'm testing for direct and consensual pupillary response. Good. And now the other side. Good. So now I'm gonna look at the back structures of your eyes. So same thing, I'm just gonna have you look straight ahead at me. I'm gonna start with your right eye. So like this. Gonna start, I see the red eye reflex, and then as I get closer, I see the blood vessels. As I move medially, I see the disc in the cup, and as I look laterally, I see the fovea and the macula. Sorry. I'm gonna go to the other side now. Okay. Same thing. I see the red eye reflex, and as I look closer, I move medially, I see the disc and cup, and as I move laterally, I see the fovea and the macula. Good. Okay. So that completes your eyes. I'm going to move on to your ears. Your ears are symmetrical. Does that hurt at all?
Mm-mm.
Good. I'm going to perform the whisper test, so you're just going to repeat after me.
Red, white, blue, dog, cat, mouse.
Good. Now I'm going to perform my otoscopic exam. Good. Okay. I'm going to pull the pinna up, back, and out. Your TM is pearly gray. Your external auditory canal looks good. Good. And now I'm going to do the other side. Okay, pull the pinna. Okay. Same thing. The TM is pearly gray. The external canal looks good. Good. Okay. Now I'm going to move on to your nose. Your nose is midline with no deviations or scars. I'm gonna perform the sniff test, so I'm gonna cover one nose and you'll take like a sniff. Good? Good. Now I'm going to look at your mucosa in your nose and the turbinates. So I'm just gonna pull this up a little. Sorry. Good. No obstructions or polyps. No obstructions or polyps. Okay. Now I'm gonna move on to your mouth. So, if you could open your mouth for me, I'm gonna be looking just kind of around, looking at your lips, your gums, your teeth. Looks good. Your buccal mucosa, your upper and or your soft and hard palates. Stick out your tongue for me. Looking at your tongue and then lift your tongue. Good. And then your posterior pharynx and your uvula. Good. Can you stick out your tongue and say ah? Good. And now the gag reflex. Good. Okay. Now I'm going to be looking at your neck. Your neck, it looks symmetrical, no bumps or deviations. Your trachea is midline. I'm going to palpate your lymph nodes. So starting at your pre-auricular, post-auricular, your occipital, and then your posterior cervical chain, your anterior cervical chain, your supraclavicular, and then up here your submandibular and submental. Good. Okay. Now we're going to take this and I'm going to palpate your thyroid. So I'm going to have you turn this way. Good. So you're going to take a sip of water and then hold it in your mouth until I say so.
Okay.
Good. So I'm going to feel your Adam's apple and go below that and out. Okay, put your head down and go to the right. Good. And swallow. Good. Okay, I can start over. We'll do the other side. Okay, put your head down and to the left. Pushing to the right and swallow. Good. Okay. And now we're going to move on to your respiratory system. So I'm going to have you take your shirt off for me. Looking at your chest, there's no bumps, lumps, everything looks symmetrical. Your AP diameter is 2 to 1. I'm going to percuss first. Down. Okay, now I'm going to percuss the back. Good. Now I'm going to focus on your heart. I'm going to listen first, sorry. So you're just going to take a deep breath every time my stethoscope moves. Good. Now you're back. I'm gonna focus on your heart. I'm gonna have you lean forward for me. There's no heaves or pulsations. Okay. Now I'm gonna palpate your carotid. Oh, you can sit back. I'm gonna palpate your carotid arteries one at a time. Good. Good. And now I'm gonna listen. So you're just gonna take a deep breath and hold it in. Okay. And hold. Good. You let it out, and then I'm gonna send you with the bell of my stethoscope. Take a deep breath again and hold it. Good. And now I'm gonna listen to your heart at the 5 points with both sides, and then we'll do a lie down. So you could just breathe normal. So the aortic, pulmonic, Erb's point, tricuspid, and the mitral. Good. And now I'm going to do it with the bell. Good. And now we'll do it lying down. Oh yeah. Sushi, come. Come. Stay. Feel like, I don't know. Okay. So the 5 points again with the diaphragm first. Good. And then again with the bell, aortic, pulmonic, Erb's point, tricuspid, and mitral.